morning, good, well, it's still good morning also in most parts of the world, I know, to everyone who is on this call and on this webinar. I'd just like to say that we are super happy to have you here. And it's a great pleasure to welcome you to this edition of the Patient's Periscope webinar series in partnership with the American Business Council. We like and we're thrilled that this important conversation focusing on AI and how it enhances the quality of healthcare delivery is something we are discussing today, because obviously we all know that this is really so topical right now. And so when we were thinking of putting this together, we looked at what should we be talking about AI, and you know, how is it impacting not just globally but also in the continent, especially as we begin to look at this with the issue of healthcare and how this sits at the forefront of the transformation in that sector. And so you know, over the last few weeks as American Business Council, we've been very much neck deep in the conversation of AI. There was the AI conference that happened between the 9th and the 11th. And it's almost like when you think of a topic, it just kind of pops up everywhere. Just 2 days ago, there was also this event meeting that I joined with Meta with a focus on AI as well. So obviously, like I said, today's topic is so relevant to us. And it speaks at, you know, exploring the potentials that it would help, AI can help revolutionize healthcare in Nigeria, from the area of diagnostics to treatment planning and even resource management. But it's not without its own challenges, obviously, and especially in the context of our healthcare system with all the issues around infrastructural gaps and, you know, ethical concerns, and even the shortage of AI-ready skills. So today we will explore not the current application of AI in healthcare alone, but also the potentials that lie ahead, especially as we begin to address issues around challenges, but also the benefits for Nigerians, regardless of where they live or even their economic status, because we know that obviously widening the dragnet on understanding what AI is from a socioeconomic perspective is very critical. And so we're extremely, I don't want to hold everyone, and I actually promised I was going to do this in less than 2 minutes. We are privileged to have a very distinguished lineup of experts who are at the forefront of AI and who in healthcare, and who definitely, you know, will share their insights and would help provoke the right thoughts, inspire actions, and probably lead us to understand tangible outcomes that may derive from AI and its usage in the continent. So over to you.
Thank you so much, Mrs. Margaret Olele, who is the Chief Executive Officer of the American Business Council, for your welcome remarks and for setting the tone for this particular webinar. I would like to introduce the moderator of the panel for the conversation we will be having in the next 30 to 45 minutes, where we will be looking at what the role of AI in our healthcare industry will be, and how that prepares us for this generation and for the generation that is to come, seeing that artificial intelligence is rapidly transforming the various sectors within the healthcare, and quality of care and improving health outcomes is a major opportunity for us in the field of artificial intelligence as we deploy it to see how we can better improve the health indicators for Nigerians as we march towards achieving universal health coverage. So not to let the cat out of the bag, and to bring on the moderator of this very learned panel, I'd like to introduce Dr. Nneka Mobisin, who is the Chief Executive Officer and the co-founder of MDocs. Dr. Nneka Mobisin is a digital and social health enterprise expert, working in the field of AI, and she works currently as the Chief Officer of MDocs, a digital health social enterprise, which provides AI-enabled virtual self-care coaching to people living with or at risk of regular and chronic health needs. MDoc harnesses behavioral sciences, quality improvement methods, technology, and data to help people live healthier lives. Prior to MDocs, Dr. Mobison was the executive director of Africa at the Institute for Healthcare Improvement, IHI, where she still serves as a faculty advisor. She is a pediatrician, and Dr. Mobison was the vice president of Community Health and Population Health Management at Connecticut Hospital Association. At McKinsey & Company, she also worked on healthcare strategy and technology. She has worked at the World Bank, Merck, and CDC. Let's welcome the moderator of this panel, Dr. Nneka Mobison, to set the tone for the conversation. Thank you, and over to you, Dr. Mobison.
Thank you so much, Dr. Anne Adaogo. It's my greatest pleasure to be with you all, and a huge thank you to the American Business Council and the Private Sector Health Alliance of Nigeria, PSHAN, for the invitation and for elevating this critically important conversation. As Dr. Anne shared, I run an AI-enabled digital health social enterprise, and we've been working with AI for close to 5 years now. And as AI continues to evolve, it's becoming an increasingly vital tool in addressing some of the most pressing challenges in healthcare today. If we look specifically at generative AI, which is a component of AI, I think a lot of times now people think AI is only Gen AI. But if we look specifically at Gen AI, the Gen AI market is projected to surge to an astronomical $120 billion by 2030. And I'll say that again, an astronomical $120 billion by 2030. And we all know what 2030 means for our world when we think about the Sustainable Development Goals. And with its most exciting impact anticipated to be in the healthcare industry, from improving diagnostic accuracy, as Mrs. Olele rightly highlighted, to personalizing prevention and optimizing treatment, AI holds incredible potential to really change what we know healthcare and health to be today. If we look specifically at Africa, Africa represents only 2.5% of the global AI market. But emerging applications and some of the innovation across the continent today could boost our economic growth by $2.9 trillion by that same year, 2030. The reality, though, is the path to widespread AI production and adoption in healthcare on our continent in Nigeria has a lot of challenges. Mrs. Olele highlighted some of them: infrastructural deficits, financing barriers, the ethical realities, and the lack of skilled personnel are hindering our progress today. Additionally, as you look at the readiness of our healthcare systems in Nigeria and Africa to integrate AI, combined with the absence of comprehensive supportive regulatory frameworks, further complicate the landscape and the potential of AI to address our divides, to address our healthcare disparities, especially at the community level. And so in our conversation, we're really excited to have incredible panelists, experts working in the AI space who are going to help us really kind of unlock current and potential opportunities and challenges, and what strategies we can think about to really scale up these technologies in Nigeria. And we'll look at some of the ethical implications of AI and understand really how to foster collaboration between the healthcare and technology sectors to drive sustainable innovation in Nigeria. This is why I am particularly excited to introduce our panelists today. We have Mr. George Uduku, who's a medical doctor and business leader in medical devices. He is currently the general manager of GE Healthcare West Africa. He has extensive experience in strategy, new market entry, project development, and sales management, He's responsible for driving a coherent commercial strategy across the entire GE healthcare businesses in West Africa, while optimizing the use of commercial and service resources and achieving GE's goals to help deliver sustainable and accessible integrated patient care across the region. Prior to joining GE, he was with Philips Healthcare, where he held several leadership roles in both markets and business organizations over a 10-year period. We're also excited to have Dr. Hamed Ninalowo, who is the founder and CEO of IR-Doc Nigeria. He is a US-trained double-boarded diagnostic and vascular interventional radiologist, and he is the first US-trained physician to offer the full spectrum of interventional radiology services in Nigeria. He started his practice, IR-Doc Nigeria, in 2018, and has since moved his practice primarily to Nigeria to deliver interventional radiology care to Nigerian and sub-Saharan African patients. He's pioneered many procedures in Nigeria and West Africa, and it's really important to highlight that he's well known and passionate for the treatment of uterine fibroids with a minimally invasive procedure called uterine fibroid embolization. He's the co-founder of AccuRead Radiology as well, the first Nigerian teleradiology company providing remote teleradiology services to many hospitals in Nigeria. We also, we're hoping to have Dr. Anthony Adoge, the Deputy Director of the Federal Ministry of Health, Nigeria, joining us. As you know, given kind of all the incredible work that our Ministry of Health is doing in terms of transforming the narrative of healthcare in the country, we're hoping that he'll be able to join us. He's currently has something that he is attending to, but hopefully he'll be able to join us during the conversation. He is a digital health enthusiast. He's been leading a lot of the AI work from a regulatory and policy perspective in Nigeria. He's a public health specialist and the current head of monitoring and evaluation in the Federal Ministry of Health. Specifically, he oversees the unit responsible for the routine health information system, HMIS, health surveys and assessments, as well as digital health. He's also a medical doctor with over 18 years of public health experience, with a focus on healthcare coordination and standards. And hopefully he will be able to join us to offer his experience and expertise and thoughts on the policy and regulatory reality of implementing and producing AI for health in Nigeria. I only touched the surface of the bios of my esteemed panelists. So feel free to Google or ask your preferred large language model about the panelists to learn more. They are all physicians who decided to specialize, whether in business or management or medicine, outside of the country or African continent, and they all returned home because they believe and are demonstrating to us what a new tomorrow for health looks like in Nigeria and in Africa. Our goal today is to spark informed discussions and collaborations that will help us harness the full potential of AI, really helping us potentially leapfrog. And we're hopeful that beyond this platform, we'll continue to engage with the relevant stakeholders to ensure we build on the action points from this conversation. So we thank you again for joining us today, and we look forward to your active participation in this discussion. Please feel free to use the chat function as we start having the conversation, and I'll get to your questions throughout the discussion. So let's start with you, Dr. Uduku. AI is often hailed as a tool to improve healthcare accessibility, but infrastructural deficits remain a major challenge in West Africa. Given your leadership role in healthcare strategy across West Africa, what role is AI playing in improving healthcare accessibility in the region, especially in areas with limited infrastructure? And what is its potential? It'd be great to hear from you. Over to you, Dr.
Thank you. Thank you very much. Good morning, everyone. Thank you for having me. That's a great question. One of the major advantages of AI, I would say, is its ability to optimize scarce resources, right? By offering scalable and adaptable solutions, even in low resource settings. So at GE Healthcare, our approach to overcoming accessibility and infrastructure challenges with AI is threefold, right? So first, we extensively integrate AI into our mobile systems, and these are the systems that require only the basic infrastructure, right? By leveraging AI on these mobile systems, GE Healthcare extends care deep into the rural communities, eliminating the need for patients to travel long distances for care. Now, secondly, our AI applications are deployed on board the systems, right? Rather than relying on, cloud-based platforms. And this means that we do not require, complex networking infrastructure. And this makes them ideal for low connectivity environments. And the third is our AI-driven tools empower frontline healthcare workers with critical decision support, ensuring accurate and timely diagnosis, right? Even in settings where, specialists are few. So let's take a look at a few examples of how we are leveraging AI in innovative ways. Take AI-assisted ultrasound technology, for example. In areas where radiologists are scarce, AI can help interpret scans in real time, allowing for less specialized healthcare workers to provide accurate diagnosis, all with just a handheld device that can fit into your pocket, right? So this greatly expands the reach of healthcare services in rural and underserved populations. And we can therefore identify, early complications of pregnancy, before they lead to significant morbidity or mortality. A second example is, GE's Thoracic Care Suite. This is a software application on GE's mobile X-ray systems, right? It uses advanced AI to assist clinicians in detecting common chest abnormalities like pneumothorax, pneumonia, all from a single chest X-ray, right? So the tools automatically analyze the images and can flag potential issues for radiologist reviews, right? A third example is a Critical Care Suite, which is another software application powered by AI, enhances bedside imaging in critical care environment, right? It can automatically detect, pneumothorax at the point of care, prioritizes images for review by radiologists, again, allowing for quicker diagnosis and treatment, right? So both suites make available advanced care in low-resource settings where time-sensitive decisions are needed. So look, I would say that the potential for AI to improve accessibility is enormous. In the near future, we expect that AI-driven, telemedicine will be quite rampant and enable patients in remote areas to access specialist care without traveling long distances. We expect that, we'll be better able to predict outbreaks and, manage public health data, right? And governments and organizations can allocate resources more effectively and improve healthcare delivery across the region. So while infrastructure challenges remain, I would say that, AI is giving us the tools to work smarter within those constraints. And by enabling earlier diagnosis, improving patient triage, making expert care more accessible, AI is transforming indeed how we think about, healthcare delivery and healthcare accessibility in West Africa.
Wonderful. And I guess just a follow-up question to that, Dr. Dukwu, is whether you think that this is, for Africa, do you think that we have the same opportunities, just in some these specific areas that you highlighted that GE Healthcare is focusing on, that we have the same opportunities for this implementation, for this integration? You gave the example of pneumothorax and really supporting radiologists, et cetera, other physicians in terms of clinical decision support. Do you think that we have, in terms of widespread adoption across Africa, that it's as likely from a feasibility perspective as it is across, the West and other environments?
Absolutely, absolutely. If you think about it, a lot of the enablers that need to be in place are already around, right? When I think about AI adoption in Africa, I always look at the banking system. I always look at the telecommunication system, right? We are, I would say, arguably way advanced in West Africa than any other part of the world, right? And the reason for that is this is where the challenges were the greatest, right? And so we leapfrogged essentially the traditional development path. And I think you will see the same with AI as well. The challenges that AI solves are greatest in Africa than in the West, right? And if you just look at, telecommunication penetration, and, infrastructure readiness, when you talk of digital transformation, like I think that the potential for widespread adoption in West Africa is quite huge. I'm quite bullish and positive on the prospects.
Love it. Love it. And I think that's, and I think we actually, to your exact point, we actually have a lot of data to highlight that there's incredible innovation happening across the continent in AI. I personally have had, actually even just this week at the UN General Assembly, I've had a number of conversations where folks have really been extolling the incredible work that's happening on the continent in AI. So great to hear you highlight that, also from, the GE Healthcare perspective. Over to you, Dr. Ninalawo, because you are, an innovator in this space as well. And I think as Dr. Duku was talking about some of these examples, I was actually thinking what a beautiful segue to you and the work that you have led in interventional radiology and in teleradiology as well. And so AI, as Dr. Duku has highlighted, AI has the potential to really significantly improve diagnostic precision, particularly in specialized fields like interventional radiology that you are leading. As a major stakeholder, as an innovator, as an entrepreneur that has supported and really catalyzed the introduction of interventional radiology to Nigeria and broadly Africa, what opportunities do you see for AI and enhancing diagnostic accuracy and treatment across the various tiers of health providers in Nigeria? And how are you harnessing AI today in your work?
Thank you very much for the introduction. So one of the biggest challenges we found in Nigeria generally, as far as interventional radiology, as obviously was awareness, right? So I started doing interventional radiology in Nigeria about 6 years ago. And at that time, the specialty just did not exist in Nigeria. And not just awareness in accurate diagnosis and sometimes making an accurate diagnosis for some patients. And sometimes even when the diagnosis is made, the referral pattern is not there because specialists, doctors are not aware of which specialists to refer to because they don't know what interventional radiology could do in those settings. So if you look at the US, for example, an interventional radiology, a hospital cannot run without interventional radiology, both in routine care and trauma services where we run in to stop bleeding in a lot of different situations. And this does not go just for interventional radiology, but for all the other super specialized fields of medicine where doctors could make a significant impact, but other doctors are not aware of what you could do. So I'll give you an example in a diagnosis and quick referral, in this realm of diagnosis and quick referral. There was a doctor at the University of Ibadan who was a radiologist, by the way, who ruptured a cerebral aneurysm about 2 months ago. And knew from his initial rupture that this seemed like this was a cerebral aneurysm, a brain aneurysm, but did not get a CT scan and basically went to a regular hospital where they treated him for malaria, right? If you have AI integrated in those decision makings, right, and somebody says, I had the worst headache of my life, I had a thunderclap headache, those keywords being put into an AI algorithm basically tells you, do not treat for malaria. This is cerebral aneurysm. Go get a CT scan to make a diagnosis. They waited a week until he had another headache, another big headache to get a CT scan. And then by that time, he had proptosis of his eye because the aneurysm had ruptured again, right? But he was lucky because his aneurysm, he didn't die from those two ruptures. We were still able to treat him in a good amount of time for him to get treatment, and he did quite well, right? But again, putting those keywords in an AI algorithm would significantly decrease the chances of that treatment delay because many people are not lucky in that setting, right? Another place where we've seen where AI can really enhance the practice and enhance patient care in this environment is referral patterns, right? So liver cancer is one of the biggest diseases in the world as far as biggest killers of cancer. So hepatitis B is quite prevalent in Nigeria, and a lot of patients get liver cancer in Nigeria. And interestingly, the diagnosis for liver cancer is usually made sometimes very early in some patients. However, knowing who to refer to or what to do in those cases is a challenge for a lot of doctors. So there's something called the BCLC treatment criteria, where it's a standard treatment criteria we use everywhere in the world. Now, think about an AI algorithm where a patient's diagnosis, their performance status, their labs are put into this criteria, are put into an algorithm, and that algorithm is telling you this is where you refer this patient to, right? That would be simple and that would be easy for everyone to know who to refer to in the stage of liver cancer, right? We end up seeing a lot of patients where, the tumor has progressed significantly. They've moved from stages where we could be of impact to a stage where we can't do anything anymore. And then they show up to us. And by that time, we basically say, sorry, it's been too late. Your doctors have spent too much time doing the wrong thing and we can't help you. So really, in making accurate diagnosis and also enhancing referral patterns, AI could be a significant tool for us.
That's incredible. I mean, I think that both of you have really highlighted the transformative potential for us, and especially in our unique context, right? Where a lot of our healthcare providers often, would benefit from that clinical decision support, guidance. They're working in overburdened healthcare system, and a variety of factors that may lead to under precision, sometimes in diagnostic accuracy and referrals. So this is kind of you've laid out very clear examples of what it will take. But I actually want to build on that. The example that you gave with malaria, and let me just quickly say to everyone, please share your questions, your thoughts, your reflections based on what our panelists are sharing. Please put them in the question and answer box so I can ask them throughout this conversation. But, you highlighted the malaria example, and I think it's a really important one, because if you look at care provision here, I mean, so many folks will give an example of, somebody was suffering from a heart attack, in this case, a cerebral aneurysm, and they were diagnosed with malaria and tetanus. And so when we look even at malaria, rapid diagnostic tests were introduced several years ago. To really aid, again, as a clinical decision support tool. And I can't tell you how many doctors or nurses will say, yes, it's not, the rapid diagnostic test is saying negative, but these things don't really work. So we're going to treat for malaria. So in terms of the health workforce, and we talk about the transformation, but we also know the realities of our context. And so when we kind of think about the health workforce, AI integration really requires a workforce that's proficient in these new technologies that both of you have highlighted, which places significant pressure on clinical education. And so given the demand for highly skilled personnel and personnel that actually will believe the technology, to operate AI systems, how do we position our current education, our medical education, our allied health workforce education to prepare future healthcare providers for an AI integrated healthcare environment that really completely transforms patient outcomes? Because in your case, as you highlighted, Dr. Ninalawo, it's really wonderful that the person who suffered the aneurysm is still with us today. I mean, it's a real blessing, and I'm so glad to hear that. How do we ensure that more people have successful outcomes with no complications? What does it require in terms of the health workforce and our education systems?
So, I mean, you quoted some really big numbers when we started this conversation, and I think we all know that AI is the future. So I think that's been answered already, right? And we've also said that AI might actually make doctors dumber. Some people have alluded to that. But I kind of disagree with that, because I think AI could only enhance how we deliver care to patients. So just like learning physics in medical school, learning anatomy, and we learned some really useless things in medical school, by the way, but we really need to basically start to talk about integrating learning technology education into medical education, especially in a place like Nigeria, where, again, we're so far behind in healthcare. It's you just can't imagine how far behind we are in healthcare, right? And the reason people are so far ahead in healthcare in places like America is because technology has been integrated into medical education so early. We're using tools to make diagnoses on our phones when we're seeing patients. We're using pictures of rashes and using AI to make a diagnosis. So there's no question. So early integration of technology will create an environment where our students could learn that they don't have to basically be busy cramming stupid things in medical school like a lot of us do, but actually using tools that would enhance patient care in the future. So it's basically very simple. We have to integrate technology into medical education.
Could not agree more. There's so many opportunities, and to the point that you all have made around even just mobile phone penetration, etc. I mean, we're using phones. We're using phones for tech, for fintech. Why can't we actually even leverage the phones in terms of helping medical education, right? Like we're using technology in our day-to-day. So there's clear opportunities. And so how about Dr. Duke? I actually would love to hear your perspective on this as well, on what's the workforce required, and I'd also extend beyond the medical workforce. Are there other folks that we also need to be considering that we may not have in this environment today? What kind of investments need to be made?
Look, I think that we need to get to a point where the practice of medicine is, I always like to describe it as idiot-proof, right? You can only achieve that when, artificial intelligence is integrated into our protocols, just as Hamid has alluded to, right? AI will never replace doctors, absolutely not. But AI will replace doctors who don't adopt AI, right, and apply that in their work. Absolutely. Look, there is a lot that we need to do. We need to integrate absolutely AI into our medical curriculum, right? There has to be regulation around the safe and ethical use of AI in our practices, right? Things like this are sometimes not necessarily adopted very easily, right? Regulation sometimes has to drive quality. And this is a critical element in terms of our path towards quality care, right? And that has to be driven by regulation as well, both in terms of the curriculum and in terms of how we practice medicine. That's my view.
So it's interesting. There have been a lot of conversations around whether regulation promotes or stymies innovation. And you highlighting that regulation and education is critical. It's interesting. The more I got involved with AI, I said, look, my kids all have to take Python classes. And their schools are not teaching them Python. So I, found an online tutor in a different part of the world who is teaching them Python every single week. And I think, and it just became, I got worried, right? Because I was like, if our education systems, I think it may even start earlier, right? How can we ensure, at a pre-primary education level, we're teaching our citizens to actually have critical problem-solving skills, so that, because I think a lot of our education is around rote memorization. And if you're going to, if you look at generative AI and the large language models that we all know, garbage in is garbage out. And sometimes you still see the garbage has been put in and not really critically thinking how to leverage AI. So we still need problem solvers and thinkers to be able to effectively work with these AI tools. but also to build the AI tools for, we don't want to just be consumers and users of AI on this continent. We want to be producers. Why can't we have our own a GPT equivalent or a Llama equivalent on this continent that we have created and contextualized to our realities? So I think it's a critical point that both of you have highlighted on what's needed and what's required. So I just want to ask you, you touched on kind of that regulatory aspect, Dr. Duku, and you touched on the ethical. I'd love to kind of double click on that a little bit more. We keep on hearing about responsible and ethical AI. We keep on hearing about how, and there's been so much kind of conversation around the bias in AI. That often is incredibly harmful. And there's been a lot of work trying to address that. From the GE Healthcare perspective, do you think organizations such as GE Healthcare can support in addressing the ethical and regulatory hurdles that are associated with AI deployment in healthcare, particularly in the West African context? I'd really be curious, about what your perspective is on that. And if so, what are the types of mechanisms that could be effectively and sustainably employed to ensure that we're addressing some of those ethical and regulatory hurdles?
Okay. Look, absolutely, yes. Organizations like GE Healthcare are in a unique position to support the development of ethical frameworks and regulatory standards for AI deployment in healthcare, particularly in West Africa. AI's integration into healthcare has significant potential, as we've been discussing, right? But it also introduces challenges, right, such as data privacy, algorithmic bias, equitable access, So addressing these issues is critical for ensuring that AI benefits everyone, especially in regions like Africa where, healthcare disparities are quite prominent, right? So the first big issue is data privacy and security. Addressing both is critical, particularly in regions where healthcare infrastructure is still evolving. GE Healthcare has invested heavily in secure data management systems to protect patient information, while leveraging AI's capabilities. And implementing AI responsibly means that, it means ensuring that patient data is anonymized and protected, preventing misuse while still allowing AI systems to learn from large data sets, right? Now, in this regard, collaboration with government and regulators is essential. GE Healthcare can support local governments in establishing AI regulations, that meet highest standards for patient safety and data security, right? We've already seen this in other regions where we've partnered with regulatory bodies, to co-develop guidelines. And for West Africa, this means, working with the health ministries to build frameworks that are aligned with local needs while adhering to global best practices. Another key issue is algorithmic bias. AI systems are trained on data from populations, right? And those systems that are trained on data from, say, high-income countries, may not be fully effective when applied to the African context. You've alluded to being producers and not just consumers, right? A couple of times on the call already, So GE Healthcare can mitigate this, by working with local healthcare providers to develop AI models, based on African data sets, right? And this ensures that AI tools are culturally and contextually relevant, and then reduces the risk of biased outcomes. And then lastly is capacity building. This is essential for sustainable implementation. GE Healthcare has trained healthcare professionals, technologists, regulators, in safe and effective use of AI. So by fostering local expertise in both clinical and technical aspects, I believe that we can empower West African healthcare systems, to manage these tools independently and ensure their long-term success.
Fantastic. That's actually really exciting. I think that we've seen a lot of recognition that building the AI literacy in healthcare providers, in governments, in private sector is really critical to enhance adoption and to enhance kind of, as you rightly say, this ethical use of AI. You highlight the data sets piece, and I think that's a really critical element because, you know, I've been in a lot of conversations where folks have said, oh, you know, in Africa, we don't have data sets. And I'm like, we have data sets. We are sitting on large data sets. And, you know, the question is, what investments can be made so that we can actually leverage those data sets to fine-tune large language models so that we're ensuring exactly what you've highlighted, contextual, realistically relevant to our reality, our context, what we're able to provide, so that it's really for you know, it's for our members of our population. And there's a lot of efforts that have been done. I mean, I can say even at MDoc, which I lead, we've been intentional around leveraging some of just a small portion of our existing data sets that represents historical member patient conversations to fine-tune our model so that it's better able to provide that personalized coaching supports to the people that we serve. And it's working. We've been able to evaluate it across metrics like empathy, contextualization, safety, accuracy, and the results have been pretty encouraging and exciting. There are questions coming through the Q&A, so thank you to the audience. I will pose them to our esteemed panelists just in a second. I just would like to ask you, Dr. Ninalowo, what would be your wish list from a regulatory perspective? If you could ask the government to really kind of invest on that regulatory side, you are an entrepreneur. You have been in this tech enabled space, I guess, in terms of your entire medical career, but really bringing it to Nigeria so that patients can benefit. You know, how, and I will say, you know, I think it's pretty exciting to see what the Honorable Minister, Dr. Tijani, has done. Our Honorable Minister of Health and the Honorable Minister of State of Health in Nigeria have also been very intentional around AI and tech, and it's been exciting to see some of the summits, the workshops, the strategic efforts that have been done. Mrs. Olele highlighted them. If you were to kind of take a step and kind of look broadly and look at what you've learned over the last several years in terms of integrating digital, what lessons can you apply in terms of what advice you would give to governments in terms of what we need from a regulatory perspective? And do you believe that we need different regulation and do you think it will foster innovation or do you think it might stymie innovation in AI?
As far as regulation goes, I think the biggest thing is, you know, protecting patient data, right? You know, as you said, people think we don't have data in Africa. Look at Accurate Teleradiology, for example, our small teleradiology company. We have a significant amount of data aggregated across multiple hospitals in Nigeria and Ghana now, right? And we've had several folks approach us to buy this data, but we've not sold the data yet or we've not even explored selling the data yet because we don't know what the regulations are in Nigeria yet because there are no regulations protecting us from this. So we need to basically at this point, you know, accelerate putting those regulations in place, but we could lean on things that are already done in other countries, right? Because these are things that are moving very, very fast. And countries like ours, we just really do not have the resources to move as fast as the technology. So we could really leverage on what has been done in the European countries or the Americas as adopting some of these regulations. But, you know, most importantly, we have to understand that, you know, AI is a significantly good tool, but at the same time, make sure that we're protecting patient data. And I think most of the regulations should just focus on protecting patient data without significantly hampering growth.
Wonderful. And both of you have really highlighted this critical piece around protecting patient data and privacy. And fortunately in Nigeria, we do have the NDPR. And so I think that from a country level, we've already shown that commitment to protecting patient data, and we can really leverage that and build on that when we look at AI specifically. So taking questions from the audience, just encouraging folks to share your reflections and your questions as well. So we have a question coming from, let's see here. What are the examples of point of care devices that have AI infused in them? Specifically point of care, there's a lot of work being done on point of care. So I'll actually pose that to you first, Dr. Duku, and then to you, Dr. Ninalowo. Both of you probably have obviously experience with that.
Right. So you see some of the best examples, like I talked about earlier, in ultrasound systems, right? Generally speaking, we've got AI deployed on ultrasound systems, tools that can read scans, interpret scans. We've got AI deployed on very basic mobile X-ray systems, right? And even for patient care, we've got AI systems built on tools that can count, say, respiratory rates for kids, for children, right? And essentially with something as simple as a color code, guide a community health worker in determining whether this is a case that needs to be referred or not, right? So three great examples, and there are numerous other examples, of how we've deployed AI in point-of-care devices.
And those are accessible to, so if we have physician entrepreneurs or owners of healthcare enterprises who may want to access those for their clinics, for their practices, they would be able to have access to those in our
Absolutely.
Fantastic.
Absolutely.
Fantastic. How about you, Dr. Ninalowo?
So especially in the remote areas, I don't know if you've heard of this company, Nanox AI, where they have this small X-ray machine, right? Where you could basically go take an X-ray in any remote part of the world, and an AI integrated software could give you a diagnosis. And on an X-ray, what are you looking for? You're looking for like a pneumothorax. You're looking for if it's a pneumonia. You're looking for if the heart's big or heart failure. And an X-ray giving you any of those answers, especially in the screening of things like TB, could be significantly valuable, right? So we already have some of these point of care devices, but interestingly, the easiest point of care device we have is still our mobile phones, right? Where we have some apps on our mobile phones where you could put in a bunch of symptoms on the mobile phone, and it could point you to what the diagnosis may or may not be. And it could also alert you to a diagnosis that could be quite frightening, that would require you to not just go to a primary care center, think about going to a tertiary care center. And that's another valuable tool, right? We have a lot of patients that spend a lot of times in small hospitals, again, treating things like malaria, when there are these, big symptoms that you could put in an AI algorithm that basically tells you, you need to get out of thinking about malaria and thinking about something else.
Wonderful. I think those are phenomenal examples. We've done a lot of work in that space. We leverage health coaches, human health coaches, and we're seeing a lot of variation in the quality of kind of health information that they were passing on as the inquiries of members grew. And we got really worried about that variation in quality. And we started integrating large language models and testing that and doing research, trying to see, and across board, it increased their efficiency and their ability to support them. So right on that. A couple of more questions that have come in. From Mrs. Folalayoye, nice to have you here as well. Given the current status of our healthcare infrastructure today, what do you think is the cost impact? We really haven't talked a lot about cost, and this is critical. What's the cost impact of AI that we need to factor into care services? Does it reduce or increase cost? And how do we integrate this? This is a really critical piece, because everywhere you go, everyone talks about the cost of compute, I've kind of alluded to some of the costs, like from data sets perspective. What are your perspectives around this cost piece? Will we be able to really have the cost savings that some folks say we will, or do you think these are going to be astronomical costs? You can take that, Dr. Ninalowo. Let's start with you.
So I think initially it would increase healthcare costs initially, but in the long run, it would decrease healthcare costs. And I'll give you a very small example of a patient I saw yesterday. So I saw a patient yesterday that was seeing me as the fourth specialist he was seeing for a problem everyone thought was vascular. And after examining the patient and looking at the CT scan, which, by the way, was misinterpreted, by the radiologist as because there was a technical issue with the scan, but they thought his leg arteries were occluded. With an AI algorithm, you could solve that problem also with that misinterpretation, right? But he was seeing me as a fourth specialist, and after seeing him, I then referred him to a neurologist, right? But if you had AI helping us as a diagnostic tool and helping us as a referral pattern tool in the care of this patient, that AI tool should be able to tell us that this patient should not be seeing a cardiologist, should not be seeing me. It should have eliminated the problem with the misdiagnosis with the radiologist. It should have gotten that patient to a neurologist faster. So when we think about the whole spectrum of healthcare, I think it would help in decreasing costs later, but obviously upfront costs would be higher.
I think I'm also hearing that a lot, that exactly that point, that would be able to actually even accelerate scale with those cost savings. Dr. Duku, do you agree, or do you have a differing thought?
I agree. I think that, you would see an increase in cost, but what I believe is that increase in cost is marginal, right? And at the end of the day, you will find cost savings, not just in the medium term, but also in the short term, right? And you'll see those cost savings come from a couple of areas, right? First, efficient deployment of clinical services, right? And efficient investments in, clinical services and interventions, okay? And this is based on the evidence that is generated from analyzing, data sets for population health management. That is one. Second is around eliminating clinical errors, just as Dr. Ninalowo has just described, right? The cost of repeat scans and repeat visits, from medical errors, right, that would have been avoided if you had clinical decision support tools, right, that were more or less, a second opinion for every individual doctor. You'll see a lot of cost savings come from that, right? And I think that the third one is just in the coordination of care, the fact that you can avoid, a lot of duplication of services, right, and the costs that come with that, right? So from these three areas, I see a lot of cost savings, which can be achieved, not just in the medium term, like I said, but also in the short term.
Couldn't agree with both of you more. And so two last questions from the audience. So from Njide Ndidi, also nice to have you here as well. As the adoption of digital increases in the health sector, how do we begin to push for interoperability standards? We've talked about we've talked a lot about data, we've talked about data privacy, but we really haven't talked about interoperability and data exchanges, where we can advocate for data solidarity, data that is truly for public good. So what will be required to really kind of begin to push for that? You kind of hear across the world, people are still talking about some of these barriers to interoperability in our environment. Where are the opportunities? Either of you could take that.
That's a great question. It's the hottest topic when it comes to digitization of healthcare, right? And I think that that's where the biggest opportunity lies. Again, I talk about the banks, all right? The reason why we enjoy a banking system is that because the various systems and the various individual banks talk to each other, right? Everything we've talked about today will only lead to the improvements we desire once different systems can talk to each other, right? So the EMR system in Reddington Hospital can speak to the EMR system in an Evercare. That's the way you form, a holistic picture of every patient. And that's the way you gain a holistic view of an entire population, And I think this has to be one of the biggest priority areas for us as a nation, as a system. We need to make decisions on, who owns the data and, who is essentially administering that data? Is it the Ministry of Health? Is it the is it NIDA? Is it the HMOs? Right. So we need to make very intentional choices around that, and we need to build not just EMR systems in individual hospitals, but we need to be intentional around how we're building a backbone, right, that integrates these various systems together.
Absolutely. Could not agree with that more. And there has to be that investment now to make that happen. Dr. Nana, well, the last question is, and it just, both of you actually highlighted this, but I think from Mr. Innocent, he has highlighted, do we really think the superior in the medical field will accept the fact that AI is being used to reach diagnosis? Both of you kind of touched on this before, but clearly it's still that question. What do you say about that in this context?
Well, what I would say is, there's a reason old people die, because they're old, right? And, we have a new, younger generation of physicians that are coming up and believe in technology. And, we just have to learn to adopt it. I mean, we have doctors in some hospitals that have been doing the same thing for 40 years and they won't change it because that's what's worked for them for those 40 years, right? And, I hear about a lot of different stories where patients are like, there's a hospital, which I can't name, where they're still doing wrapping for cerebral aneurysms, for brain aneurysms. And wrapping essentially means you're putting this surgical gauze around the aneurysm to protect it from rupturing, right? This is something they did 40 years ago. No one does that anywhere in the world anymore, right? But there's these old guys that, this is what they believe in and this is what they still do, right? But again, we have a new generation of doctors coming up. The important thing is, those older guys are still teaching people coming up. But the important thing is getting to those younger folks to ensure that they do not just learn from these older guys and develop the same habits, but they're integrating AI and technology and using AI to actually learn in medical school, which is why it's also important to integrate technology into medical school and technology education into medical school, so people could broaden their horizons and see what's out there without being stuck on what's old.
Love it. Love it. I keep on saying this, that if we could teach, I think it's also humility, right? And humility in actually understanding that, hey, I don't know, but I can know if I bother to, just actually try to teach myself and learn and take courses. We have online education opportunities, etc. So completely agree with you there. Last question, because we have some really beautiful questions coming in. So this is a final question from the audience. What are the immediate next steps that enable application of AI in quality delivery of healthcare in rural and underserved communities? I think even a lot of times you say rural communities are the only underserved. We are urban, peri-urban Nigeria is underserved. And I'll also say that Nigeria is actually fast becoming more urban and peri-urban than rural. So underserved is everywhere across our country. What do you all say? What are the immediate next steps? And actually, let's actually have you end with that. If you all could, like, on your wish list, what is your wish list for immediate tactical next steps that really are going to enable us to transform AI in Nigeria? And what's your call to action that you would also tie on to that? And then we can use that to close out. Dr. Uduku?
Okay. Yeah. Look, see, my bold vision and wish, right, within the next 5 years is for AI to democratize access to quality care, right, in rural and underserved areas, right? I would like to see a situation where AI-powered diagnostics enable, low-skilled, low-cost community health workers to provide accurate, real-time diagnosis without needing specialists, right? I like to see a situation where, AI can drive evidence-based healthcare delivery strategies by predicting patient needs that is based on data, right, and reduce the burden on overextended healthcare systems, right, where AI can help close the gaps, ensuring that everyone, regardless of location, has access to the best possible care, right? And as a call to action, I urge government and private sector to invest in building out, digital infrastructure needed for AI to thrive. And this means data collection systems, secure networks, policies that enable innovation, while safeguarding privacy. I think this is how we lay the foundation for AI to really deliver on its full potential for transforming healthcare in Nigeria.
Wonderful. Very well said. Dr. Nyala, well, how about you?
No, I think one thing we've done well in Nigeria so far is things like mobile networks, right? There's basically internet in a lot of different places in Nigeria, so we've done well there already, right? And we need to just enhance that technology so we could build on that to, enable people to use artificial intelligence, But one thing I've always thought about, and this is a bit more personal in medicine, is basically creating centers of excellence and letting AI help us drive that, right? One of the biggest problems we have in Nigeria is lack of regulation for hospitals. So as far as, the clinical outcomes for patients in a lot of hospitals, we don't know what's happening in a lot of different hospitals. It's just hearsay, right? But if we integrate AI into showing clinical outcomes, it would help us create these centers of excellence where we see a hospital that does cardiac surgery and we know patients have good outcomes in this center. How do we then make that center a center of excellence for cardiac surgery, where people could go train, where people could get better outcomes, right? And basically help us all enhance our healthcare system. So for me, I think that is a big thing for me as far as creating these centers of excellence and letting AI help us drive outcomes and also monitor patient outcomes when it comes to what we do in Nigeria.
Wonderful. Also well said. I think this has been an incredibly inspiring conversation. And a lot of times when we get together and we're kind of talking about all the challenges, you all have really highlighted what the opportunities are. You've highlighted that AI is not just a distant vision. It's happening now, today, in our context. And there's an immediate opportunity for Nigeria and Africa's healthcare systems. We've really seen how the integration of AI can empower us, not just as users, but as builders and producers. So I'm really encouraging each and every one of us to carry this conversation forward. A huge thank you to the panelists, a huge thank you to the audience, and a phenomenal thank you as well to ABC and Pishan for actually just creating the platform for this important conversation so that catalyzes the future for us. I will now pass it on to Dr. Tinu to close out for us. A huge thank you again.
Thank you so much, everyone. It's been such a rich and very in-depth discussion. I'd like to thank our panelists and all our participants, Dr. George Uduku, who's always there for us, Dr. Hamed Ninawolo, for sharing your insights and your practical, very real-world experiences. Special thanks to our moderator, Mobison. She's kept her time and she's very skillfully guided today's discussions, ensuring that we address the most pertinent issues in this emerging field. I'd like to thank Mrs. Margaret Olele and the American Business Council for hosting this conversation and their commitment to continuing to foster collaboration within the private sector. At PSHAN, the Private Sector Health Alliance of Nigeria, we're very proud to host this webinar, reaffirming our dedication to leveraging innovation for the betterment of healthcare delivery in Nigeria. In conclusion, I'd like to encourage all our stakeholders in the healthcare space, technology space, and the policy space to continue to explore how AI can be integrated into healthcare to provide more efficient, equitable, and patient-centered care, enhancing both the quality and the accessibility of healthcare for all of us in Nigeria. Thank you once again for your participation, and I look forward to continuing collaborations that will emerge from this dialogue. Have a great evening. Thank you. Bye-bye.
Thank you, everyone.
Thank you.
Thank you.